afternoon is going to be on sustainable healthcare. In some ways, it's an extension of the last several conversations that we had, and especially perhaps the last one, because if we can't keep our healthcare workforce healthy, we ain't going to be sustainable at all anyway. So if you guys have any thoughts you want to share about the previous conversation, I love people who want to weave in previous talks. So by all means, feel free to do so, especially because you're both professionals in the field. So with that, Komal, we'll go with you, introductions, and then we'll have Chetan go it, and then go from there.
Yeah, absolutely. Thanks. And great to be here. My name is Komal Bajaj. I'm an OBGYN by clinical background. I'm honored to serve as a chief quality officer within New York City Health and Hospitals, which is the municipal health system for New York City. And about a year ago, incorporated clinical sustainability into that portfolio as the medical director of sustainability. And so, I over the course of the next, 30 minutes or so, I'll tell you how I sort of tripped and fell into this.
All right, very good. Not yet.
I have to turn it on, maybe the little. Yep.
Is that better? Maybe better? Okay. All right. Hey, everyone. My name is Chetan Sarabu. I'm a pediatrician, but I originally was actually trained as a landscape architect.
Of course. Of course. It's a natural progression.
Very natural progression, but which at the time I didn't realize how fundamentally connected landscape architecture was to health and healthcare. But landscape architecture is really about the health of our environment and how that ties to the health of us as humans, and really thinking about things through an ecosystem lens. So that's been kind of a driving force through the work that I've done over the years. I work primarily now as a director of clinical innovation at Cornell Tech on Roosevelt Island. I also co-founded an organization called CHILL, the Climate Health Innovation and Learning Lab. And I've been working more specifically in this space because when I was living in California the past few years, worked as a primary care pediatrician at a federally qualified health center in the Bay Area, where we had experienced a number of wildfires over the past few years, was taking care of a lot of children with asthma, and the wildfire smoke was exacerbating that. And I knew I had to get more involved in connecting the dots between my informatics hat to see how do we better think about the data that goes into that we have from the environmental side and start to bring that into care so that it can better take care of people that are increasingly affected by climate-driven natural disasters and weather events, in particular what we're seeing in Los Angeles right now. And then on the other side, really also have started to understand the huge impact that our healthcare system plays in worsening the climate crisis as well. So really grateful to the organizers of Health Impact for creating the space for this conversation today.
Yeah, definitely an important conversation. Although, as you know, on Monday, we have exited the Paris Climate Accords. Does that mean that this topic is now completely irrelevant? We should be talking about something else?
It means it's more important than ever.
So no, that was just a fun way of transitioning, but it is one serious question is the given how dangerous it is to be now in the DEI space, how do you feel like the sustainability conversation, especially with climate, either buttresses or aligns with the DEI conversations, and how much danger should you guys feel it is? Because that's serious, right? At least for the next year. On Monday, we left the climate accord. On Tuesday, the announcement was made that all federal workforce that worked in DEI anywhere is their jobs are now going to be reassigned. Okay, so this is like super serious. Now, I don't think it's going to impact that much in the healthcare side, but just talk about that feeling of you guys. Is do you get jumbled in with that? Is it separate enough to where it shouldn't impact it? Just talk about that first, and then we'll jump into the sustainability questions.
Yeah, so much there to unpack.
Yeah.
You want to start? Do you want me to start?
No, go ahead.
Go.
So, I think first we have to back it up one moment and talk about, when people will say the word climate, you're absolutely right. Some people's heads will go to more of a political type of conversation. But for the most part, especially in healthcare, it's a health conversation. And people will, as Chetan mentioned, you think wildfires, you think the acute smoke and breathing, but climate impacts us every day. Like, I love your background as a landscape architect because, whether it's really hot outside or you were planning a cool trip and it got canceled because it snowed, right? There are insidious impacts on our mental health and well-being, just like we talked in the last panel or was shared in the last panel. Increased violence when there are sort of climate-related issues. And so, this impacts all of us. And so while there are certainly environmental justice-related components, and there are certain individuals that are more likely to experience climate-related issues, I mean, this is something that impacts all of us in some way. I think the most interesting example in recent times also is, Chetan mentioned the fires in LA, but the recent hurricanes that happened in the Gulf area, right? There were acute impacts to the healthcare delivery in that moment there. But some of the disruptions had health impacts across the entire United States because some of the manufacturers of IV solutions were based in that area. And so if you think that, right, and if you needed healthcare in Maryland, you were impacted by the disruptions that were happening in the Gulf. And so when I think of climate, I don't tend to lump it in the DEI space because I think of it as a much broader operational and health-related conversation.
And how successful have you been to make sure that your budgets and everything else meet that expectation of yours?
Yeah.
Is it still pretty easy or is it getting harder?
It's easy because, and I can share, I'd love to hear Chetan's point of view. I can share how we've tied it into the work, the imperatives that need to be done anyway.
Perfect. All right.
Yeah.
So Chetan, start with yours, and then we'll put Paul in.
Just kind of, in this political moment we're in, really to echo what Komal said, I think when you think about and talk about climate change as a healthcare issue first, there's a lot more politically neutral ground to work with people across the board, because you're not talking about as much saving polar bears, which is important, but you're talking about the health of your children and your communities and how they're being impacted. There's also, I think, very strong financial arguments. We're seeing every year, 2024 was the warmest year on record. We've crossed the 1.5 Celsius threshold. And we're seeing with every one of these disasters, just billions and billions of dollars of costs, not just to the communities, but to the healthcare systems in terms of their impacts. And there's a paper, I think it shows by 2050, healthcare systems are expected to have an additional $1 trillion in expected costs due to climate change. And that's not even getting into kind of all the nuances. That's actually a pretty conservative estimate. And so we're also seeing in the insurance market, as people's homes are burned down, whether you actually will get paid or not. And so when you look at the financial calculus, and then health insurers, they're also really seeing that when you're not proactive about care due to environmental factors, patients are ending up in the emergency room in hospitals, where if we actually took the environmental factors in and were more proactive, it's actually cost savings for them. Mm-hmm. And so I think there's a lot of financial arguments across resilience and proactive care from an environmental perspective that are really just fundamental here, no matter what your politics are.
Yeah, and if I could just double click a little bit, right? We're sitting at a digital health related conference, right, in Microsoft, and we're here talking about sort of decarbonizing healthcare delivery, and we're talking about sort of promoting resilience to impact the health of lots of people. And so just to double click on a few facts, healthcare delivery in the United States accounts for 9+, almost 10% of the greenhouse gas emissions for the United States, about 5% locally. And if you start to sort of think back to your last encounter with health, right, or healthcare delivery, you start to sort of see why, right? Lots of single-use items are some of our drugs, our pharmaceuticals. There's a lot of sort of impact that healthcare delivery has on the environment. And yet at the same time, those same very healthcare delivery organizations, both in the walls or the virtual walls, will need to take care of, as Chetan mentioned, the increased health impact and mitigate the risks of this already sort of work that's happening. And so, for those that are sort of in this room, in this space, whether you're a founder, whether you're an investor, whether you're a healthcare delivery person, right, there's something for everyone because of some of those facts.
Yeah, and if you, as you talk about the corporate side, you're going to mention.
Yeah.
I like what you mentioned here, and perhaps something about the word when you think about sustainability, when you bring in climate, in the same way we're talking about AI, what you call something often determines what we think about it, right? So in this case, if we said we're just focused on hospital waste, just as an example,
Yep.
like the single, has that made anything easier?
It has. Yeah. So, in the last panel, it was mentioned get rid of stupid stuff, right? There's a whole initiative around that. 25% of healthcare is low value, meaning it has sort of no actual benefit on health outcomes, right? That's $1 trillion-ish, right? So there's a lot there that we can begin to go after, right? And another thing that I think is really relevant, and Shahil will talk a little bit about how we've thought about it at Health and Hospitals, is there's the top-down needs and the levers that happen. There's also the sort of grassroots. This was a shocking statistic to me. A Commonwealth Fund survey surveyed healthcare workers across the United States, and we actually replicated this survey with similar results with our health system. 80% of healthcare workers across the country, 80%, can't get a healthcare workers degree on anything, right? 80%. Believe that their organization should work on climate change. And this is the kicker, right? As we think about workforce shortages and alignment of purpose, 6 of 10 of those surveyed said, I think about my organization's stance on climate when I'm picking where I work. That is remarkable, right? Those are remarkable statistics. And that survey wasn't like a long time ago. It was in the last year and a half. And we certainly replicated that there. So here is this sort of groundswell, lots of people are sort of, I want to do this, I want to think about this. And so what we did is we started building structures in the existing frameworks we had for people to start working on climate change, right? Everyone has really great ideas often, but sometimes they don't have the agency or the pathway forward on how to do that. And so quality and safety functions are a natural target because every healthcare entity, no matter how big, how small, will have some sort of component of quality and safety because it's the right thing to do. And because of accreditation, they have to, right? And so all of those who are trying to implement those technologies, right, into healthcare delivery bump up against those sort of requirements sometimes, but they exist, right? And so as we're thinking about working on clinical outcomes, I'll give you a big example of, we wanted to reduce urinary catheter-related infections. One of the biggest sells to get catheters out faster was that we decrease the amount of waste we decrease the amount of stuff we use to maintain those catheters while they're inside someone's bladder. So if you take a catheter out 12 hours sooner, not only are you less likely to get an infection, but you also use less stuff to have to take care of it. And that was actually one of the biggest ways that we were able to get that implemented across the health system. That has huge financial ramifications related to hospital flow, related to how we get paid for things, and it has huge reputational outcomes because they're all sort of part of our ratings. So that was a way that you sort of take the existing work and existing priorities that need to happen and incorporate some of that piece. And I think, Shahid, to your point, right, there's a lot around the waste conversation that gets people really jazzed. One of the most amazing stories, I think, was we had a very senior chief of service, someone who's been around the block a lot, who said, you know what, I volunteer in my township on environmental related issues. I never thought I could bring that to my work.
At a hospital.
At a hospital, right? And now all of a sudden you have an alignment of organizational priorities and personal priorities. Do you think that person is bought in and retained? Heck yeah.
Yeah. No, it was amusing because a hospital is like a tiny city. It literally has, if you look at a regular city and you look at a hospital, everything that a real city has, the hospital has,
That's
right? Which means enormous amounts of waste possible. So Jitan, talk about what Komal also mentioned, which is, do we need to change nomenclature, reorganize to say this is more environmental than sustainability, only because of political and other concerns? And I bring this up, I mean, if we had a different administration, this would be a different conversation.
Yeah.
What do you do to make sure that your sustainability efforts are sustainable?
Yeah, good way to frame it. I think there is conversation around, how do we name some of the work and what you're doing. I think there's a bit of a move for things, instead of being called climate tech for health systems, there's the focus on sustainability and waste on one side, and then resilience on the other side, where you're trying to create more resilient health systems, more communities that are resilient to natural disasters. But I think following up on what Komal said about integrating this into the fabric of care delivery, right, from a quality and safety perspective, I think bringing that also, to this conversation from a technology perspective, a lot of the early work that I was leading in this space a few years ago through a grant at Stanford was actually exploring the role of the EHR in sustainability in health systems, because the EHR is that, care delivery operating platform, whether you're looking at it from, care, quality, research, safety, but also sustainability, because it's the place where decisions are being made on what materials to be used. It's where things are being tabulated and calculated. And so there's a lot of, efforts in specific departments, for example, with anesthetic gases and inhalers, where we have one type of anesthetic gas that is much more of a greenhouse gas compared to the others, but still have the same clinical efficacy, and similar with inhalers. And so what a lot of institutions are starting to do is, incorporate those changes, sometimes with clinical decision support in the EHR, with instructions for both clinicians and patients. So that's, one way of this work kind of being baked in there. But then I also want to bring up, in this technology with climate and health conversation, AI into this in two ways. So I think people are excited about what AI can do to help us better understand our changing climate in terms of climate modeling, and being able to better predict, when a wildfire might happen, and how can we better optimize our resources before it. People are also talking about how AI could be used to make things more efficient. But the present reality today is AI is hugely resource intensive. When we think about things like large language models, there's a huge amount of electricity and water that's used because of the GPUs that power this in the data center. So there's a Washington Post article from the end of last year which showed that writing a 100-word email with ChatGPT once requires about 500 milliliters of water, bottle of water. But it depends on whether if that data center is in Washington State, requires about 1,500 milliliters. If it's in Virginia, it's about 300 milliliters. So there's huge variations. And these data centers are increasingly the largest use of water and electricity in communities across the country. Electricity, one 100-word email uses the same amount of energy to power 14 light bulbs for 1 hour. And that's just one 100-word email. And ChatGPT I think that was using GPT 3.5. And so we're actually doing some work right now in looking at, as AI is being implemented in healthcare, from drafting messages, from being used as scribes, how do we start to understand the environmental impact? But not to say that we shouldn't use AI, but how do we make the right decisions? Because, for example, OpenAI may come out with GPT-5, or the other companies may as well. But if there's only a slight increase in clinical performance, but a huge increase in environmental cost, we think that environmental footprint part of it should be part of the AI, kind of in addition to a safety quality rubric. Also, we need to incorporate the environmental component into how we think about AI, so that we can sustainably advance AI in healthcare.
Yeah, great point. So let me ask you to do one quick thing, and then Komal, you can jump in. One, put your older architect hat back on. Explain what is a LEED, L-E-E-D, score and on buildings, and what could we do to create other kinds of scores? So like, it's one thing to say that we're going to try to do better, but it's a whole other thing to say, here's your current score, and let's go work on the score. So explain what the LEED is, and then what could we do, and then Komal, you can jump in as well.
Yeah, so LEED is a score that's used by, I believe it's the U.S. Green Building Council had created it for the energy efficiency of buildings. And can mention, actually, the buildings on Roosevelt Island for Cornell Tech have some of the highest kind of LEED certification in terms of their energy efficiency. And that, model of creating this competitive landscape could be one to which you get health systems to think about this in a way that gets more adopted. There have been other kind of similar scores. There's the active building design guidelines that encourage things like buildings actually prioritizing and creating stairwells in prominent places that encourage more physical activity in buildings. So more from the architecture world. But I think when it comes to AI and sustainability, I think there's a lot of potential in how this could be helpful from that perspective.
Yeah, and especially as you put your compliance officer hat on, compliance indicates that there is a rule and somebody follows it, and therefore they are compliant. But the rule immediately implies that there is some scoring metrics, KPIs. So let's dive into that a little bit because it's a favorite topic of yours. So
absolutely. I wanted to just pull on one thread that of the many beautiful pearls that Chetan just sort of laid out. As we think about sort of the sort of environmental component as a piece of decision making, I also feel the same way that we should all, if the single-use plastic is the thing that's needed and is going to help and be effective or save someone's life, use it, right? But the point here is that there's a ton of waste, and I think it should be a part of our decision making. So I'll tell you, the Cardinals, the BDs of the world, the major suppliers of healthcare supplies are all hiring sustainability or environmental experts because the EU requires, in order for you to be a vendor, that you must be able to sort of show what your impact is. And so the US, obviously, as you mentioned, right, has pivoted. However, the EU has not and will not, right? And so any sort of technology here that is interested in partnering with across global lines will need to have that as sort of a feature. So I just want to think that. I also think another key point is, Chetan, you brought up kind of the resilience piece, which I think is a really, really important part of this conversation. And I think of the same way that we would think about a cyber or a data breach, right? We were talking earlier from a security standpoint. If your technology and your tools help keep the business running, right, during a climate event, right, that's a feature of your solution, right, that I think can be considered, right? Data breaches are a whole sort of set of challenges, but storms and fires and, we had to evacuate an entire hospital and move all the patients because it flooded, right? That's a very micro event, but certainly could be a feature of any solution that we're sort of onboarding, right, for that resilience piece. Now, heading back to kind of the compliance or rules. So I want to mention that the Health and Human Services, up until last week, right, for many years has been touting the climate pledge. And hundreds of major health systems, the biggies, all of them, publicly signed this pledge stating that they commit to the following: to become 50% reduced in operational emissions by 2030, to become carbon neutral by 2050, and to have a resilience plan and to create governance for this work, right? So healthcare institutions signed this pledge now several years ago. We signed it in 2022, right? So there's infrastructure that exists. A lot of that is in operations and facilities. And so what happens to the pledge, not pledge? How do we navigate this? The point is that board level approval of this concept has happened in hundreds of organizations across the United States. And so those are some of the benchmarks then that people are using to see whether they've hit their sort of mark, right? And again, a lot of this is at the very least margin preserving, and sometimes can be saving.
So expand on the European requirements. What would the BDs and the Cardinals of the world be required to do in terms of KPIs? Any quick?
Yeah, I'll give you a quick anecdote, like a quick one. So they haven't. So there's right now a lot of it is based on how much you spend with an organization. So their book of business. So now some of those all of them have a multiplier. If you spend X amount of dollars, this is your anticipated, like generally speaking, sort of the carbon output. Right? Ultimately, it'll come to product level, but you cannot become a vendor, right, with the likes of the NHS if you don't have that.
And when you mentioned that the boards of directors ended up doing, like the sustainability pledges, if you want to kind of broadly categorize them, in terms of like if you were why it's just a great happenstance that you happen to have that architecture background. I've done a little bit of work in that building environment as well. They seem to be serious because they got to measure shit, right?
Yep.
I mean, you can't say you are class X and lead and just guess about it, right? I mean, it's a real thing. So that's what I'm curious about is when they gave the sustainability pledge, did you get the sense that there was some way that they would be measured 5 years from now? And what would that be? And how does it look like they're operating towards that direction?
Yeah, Chetan, you want to take that first?
Sure, I can start.
Yeah.
So just a quick primer on how we measure emissions. There is this concept called scopes, scope 1, scope 2, and scope 3 emissions. When we think about greenhouse gas emissions, scope 1 emissions are sort of the direct emissions that you as an organization produce if you have your own, electricity generating factory or fossil fuel plant. That's your, scope 1 emission. Scope 2 is really the emissions from the energy you purchase, which is kind of for a lot of healthcare systems that aren't necessarily producing their own energy. And then scope 3 is everything else. It's the emissions that come from your supply chain, from your food, pharmaceuticals, from the waste. And so the vast majority of emissions in healthcare are scope 3 emissions, but they're also the ones that are a lot harder to quantify. And so when the pledge came out from HHS and has been supported by other leading organizations like the National Academy of Medicine, the Institute for Healthcare Improvement, the Joint Commission, right? The Joint Commission has the healthcare sustainability criteria. It's not a required accreditation, but it is a voluntary one. But when the Joint Commission created this, so they looked at all the literature, what was happening from the scope perspectives, where we think we can make a difference, and then they started to create those metrics around which aspects of scope 2 could be reduced, which areas within scope 3 health systems could potentially see themselves tackling, and they gave them, there's kind of like I think a range of 6 to 8 areas, such as around anesthetic gases, meter dose inhalers, and a few others, surgical waste. And those are, and they had certain specific benchmarks that they started to put in place. Although now with the new administration, unclear where that goes. But over the last 4 years, there was a lot of work in trying to get to those benchmarks and scores.
Yeah, and the reason I'm bringing those up here is that a lot of us are builders in this audience. We either buy things or build them ourselves and then sell it to other people. And so there's some really, really good takeaways here. If you look at business continuity and said one of your business continuity we discussed earlier was that a post breach or post ransomware or data lock event occurred, what would that look like? Then you have the same business continuity post hurricane, post God-made event, right? Call it whatever, GMEs. So in that case, and what you almost have to do, and so me coming from DC, working a lot with different administrations, you got to start talking differently. Because if you care about this stuff, if you say sustainability, if you say climate, some people in the organization might not care, but leadership absolutely cares. There's a reason why people paid millions of dollars to be in the room on Monday during the inauguration. They weren't paying millions of dollars to be in the room because they enjoyed it, but they were paying millions of dollars to be in the room to telegraph their direction. And the direction was, we're okay with whatever you want to call things. Now, everybody's going to still do what they need to do, but there's one area where in healthcare we're not as astute to the politics at the mid-level, and we shouldn't be. I mean, we're here for patient care. But if you want to get things done, like you're trying to do AI, you're trying to do things and you want to focus on waste, focus on AI. But these things where we name things is really, really important, right? And that's why bringing it up here is important. But the alternate side, that's a small point. The larger point is a lot of technology that we build, whether it's infrastructure, servers, data centers, the water filtration plant, the water heaters that we're using. All of this stuff is starting to be brought back into the United States, and they're going to care about environmental factors. So as you get it into your procurement language, et cetera, if you care about sustainability and environment, adjust what you're doing so that you can get those into those procurement, and then it becomes part of your normal everyday organization. It's not a special, like, like there's not a office of niceness, right? All of us are just supposed to be nice. There shouldn't be an office of sustainability or office of waste. We should just not waste things. The problem is that just like we can't score niceness, what my problem with sustainability primarily is, especially in the waste area. So having worked in lots of medical device vendors, our general rule was, if something could be made one use versus disposable with multiple uses versus single device with cleanable utility so that the facility could clean it themselves, guess which ones we focused all of our engineering brains on, right? The disposables. For only one reason, moolah, right? And so now if the Europeans are switching the focus, awesome. The question is still going to be, how do you create these devices so that they have the maximal value in what you're purchasing? And so we have to give ideas there, right? From the hospitals, and the buyer side is to say, look, I don't mind paying you every year. I don't even mind if you give me a subscription device. I'll charge me the same for the what you are making disposable today, but don't make them disposable, right? Make them self-cleanable. So what do you guys think about that?
One thing I want to build upon this in terms of those different pressures, I think one group that we don't talk about enough, but is actually a really important force, and there's some momentum around this, is actually from the patient perspective and sustainability. There's a lot of patients who really care a lot about sustainability, patients with chronic disease who have a lot of supply, who are increasingly being vocal about having less single-use plastic. How can things be done differently so that there isn't as much waste that they're generating? And there's recently a new organization started called the Greenwell Project, with Rita Mari, who was the chair of radiology at Vanderbilt for many years, along with, I'm forgetting her name, but she's actually a lawyer who's a patient, and she's actually the CEO / chief patient officer as well. And they're really bringing a focus to the energy of patients who really care about sustainability, and bringing that as a force to healthcare systems as well.
I really love that. Every healthcare entity, big or small, has to do a community health needs assessment. It's part of accreditation, where you have to go out and you have to talk to your community and say, what matters to you? What are your pain points? What are your perceived risks? If you look at New York City Health and Hospitals, 6 of the top 10 things that our patients tell us matter to them are problems, are climate sensitive, directly climate sensitive. They're not saying the word climate. What they're saying is things like mental health, food security, right? They might say air quality. They're not saying climate, but 6 of the top 10. And if you look at, so one of the things I would encourage all of you to do as you're sort of interacting with healthcare delivery entities is, 1, look at their community health needs assessment, because you can always link back something to there. And 2, see if they've signed the HHS pledge. Because if they have, there's entire infrastructure there that exists, right? And I love that you're sort of double clicking on the patient perspective. I think for me, what I've seen, I actually got into this work. I mean, I'm a chief quality officer. There are clear, very deeded, like, things that I have to do, right? There are clear KPIs for that role. I have 11-year-old twins. When they were 6, they started asking us about sort of our own sort of footprint at home. And that sort of got me thinking. And then you realize, like, with so much in waste, with the fact that your healthcare workforce wants to work on this, the fact that there are, at least in the recent times, all of these sort of levers from above, there's a lot of momentum around it. Call it what you want to call it. It doesn't really matter, right? The point is that there's something for everyone, whether it's recruitment and retention, right? Whether it's saving dollars, whether it is carbon, right? Or whether it's, to your point, sort of patient engagement and wellness.
Nice. That's a great summary. And I know there's a super exciting topic of sustainability, but we have only a few minutes left. Are there any questions for people trying to, like, what are you guys seeing at your own facilities? How much do they care about sustainability? How much do they care about environmental factors? Do you see any almost like waffling, wishy-washiness due to changes of administration? Or do none of you want to talk about politics at all?
Shahid,
Come on, it's the
we're
afternoon.
not having a political conversation. We're having a health impact conversation.
I like
hey.
it. Anything people want to add quickly? Yes, please.
Locally, New York City, local law 97 is back and forth as a football, but it could even impact you as a tenant, not an operator for building. And not so much a question, but I encourage everybody facility space up with and get involved. Contact. They're hitting the same issues as all this facilities. Paul's point on, I'm sorry, Chetan's point. Just as far as the bottle of water, data viz and being able to put those in terms of like, imagine adding up all those bottles of water and how can we present that like a whole waterfall in the lobby of your building?
Yeah.
Showing like really get crazy.
I love that. And waterfalls make people happy, right? Win-win.
Yeah. And last thing, just touching on what you said as far as the political part, I do not want to get into politics, but maybe call it the Department of Common Sense.
Joe, I love that. And, a lot of things, right? Like the speaker yesterday, he was talking about decreasing sugar out of school foods, right? 34 pounds of sugar. Like not one person would say that's not common sense. I'll tell you just something to thread that through. So we moved to plant forward and then now plant-based meals as an option on our menu. And remember, this is millions of meals every year. Not only is there a cost savings per meal, there's also a health savings because it's just better for you. And we save 36% of our food-related emissions. Right? Win, 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 win. The things that we had to do were make them culturally appropriate. Right? The things that we had to do were make them yummy and delicious and culturally appropriate. Right? When you're sick, you want to eat grandma's comfort food. Right? Make the comfort food that people want to eat, but in a way that is plant forward.
Yeah, you guys almost the lesson is you almost have to deconstruct it from the things that are P with a little political with a little p, and deconstruct it to its common elements and just focus on those common elements because we all care about this and it's going to become more and more, it's going to get worse and worse over the next year. And then it'll settle down, after about 18 months when the new election happens and when the new election for the Congress happens. So we just have to watch out for that. With that, let's give a big round of applause for our panelists.